All of us have heard about PCOD or PCOS. So we know that this is seen in females, and the main symptoms of these are acne, irregular menses or less blood flow during menstrual periods, and there is female pattern hair loss seen in such patients where there is baldness seen, gradual baldness seen over the vertex area, and then generally where we part our hair, there we see the thinning of hair. And in these cases there is hirsutism also seen, in which we see that there are unwanted excessive hair growth over beard area, mustache area, or it can be seen over whole body also. So these are some of the changes which we see in PCOD. When we do blood test, it is seen that there is increased in insulin levels of such patients are increased, and there may be borderline increase in lipids also. And suppose this goes on, then after 30 age or after 35 age, it is seen that they have increased chances of having hypertension, blood sugar, diabetes, as well as atherosclerotic diseases, as well as heart attack, and increase in cholesterol levels. So all these we have seen in females, and they report early to the dermatologist or gynecologist just because they see their symptoms early. Irregular periods itself is one of the symptoms for which they show to the doctor. Now what happens in case of males? We can say that in a study it is found that the relatives of such female PCOD patients, like son, father, or their brother, so if they are related genetically, so if they are followed up, it is seen that they also have some of the symptoms like these females, like increase in weight, acne, male pattern hair loss, increase in lipids, insulin resistance, acanthosis nigricans, increased risk of diabetes, hypertension, heart diseases. So as they are genetically related, so all these factors come, genetic factor, hormonal factor, as well as the metabolic factor. So many times it is in that patient comes to the dermatologist just for acne, just for male pattern hair loss, and when we do workup for these patients, when we do blood investigations, then we find out that there is increase in insulin. If they do not change their lifestyle, then after some years there is a risk of diabetes, hypertension. So these signs are seen on face and skin and hair. If we pick up these signs and we start improving our lifestyle, we decrease our stress, we just do exercise daily, and we have our we stop junk food, we start healthy diet, then this healthy lifestyle will eventually decrease our risk of having hypertension later on or diabetes later on. So we should whenever we have such symptoms, then we should know that we are at the risk, genetically at the risk, and by having lifestyle changes we can at least decrease this risk. So as it is seen in female, in males also there can be equivalent of this PCOD, but as they do not have ovaries, as they do not have menses, they don't pick up these symptoms early. But if they have acne and weight gain, then they should have these tests done, and they should show to their dermatologist.